So today I am joined with Dr. Kelly Sutton, who is integrative medicine family practitioner and is one of the co-plaintiffs in our lawsuit against FSMB, six medical boards and their officers. And Kelly sort of came under scrutiny amongst the four plaintiffs. She came under scrutiny first, and it really started in California. So, Kelly, can you give us sort of an overview of what happened with your license in California that prompted our lawsuit?
Yes. Parents lost the right to make decisions about vaccinations for their children entering school in 2015, and the law became implemented in California in 2016. And right away, a group of physicians, most of us integrative, determined this is not fitting with our experience of practice. We've seen injuries from vaccines. We hear people's requests and stories. And so we decided to do vaccine medical exemptions because that was the only thing left that would allow children to attend school and not have every vaccination on the California mandate list. And the law allowed us to do that. It was very flexible. There's quite a story around the hearings that led up to this. The public outcry was remarkable and seemed to be totally ignored, except that in the wording of the legislation, the word contraindications was removed and it was left to the physician's judgment. And in the legislative discussion, Senator Pan, the bill's author, said things like, it could just be a note and the medical board will never challenge this, and other things that became outright untrue as we lived the reality following that. So within the couple of years following, we became aware that there was a medical exemption pilot program, MEPP, and that was brought together by Charity Dean, the director of public health in Southern California, and she convened 58 counties, all the counties in California, their representatives from public health and school nurses, and educated them in how to peruse records in schools and identify exempting doctors. Some transcript from this meeting was leaked and people learned about it, so we knew this was happening. The records were given to the some newspapers, and the one in San Diego actually published names of exempting physicians. And so we were really had big targets on our back, big bullseyes.
Yeah, when that
And
happened, well, real quick, when that happened, did you
mhm.
have random people coming after you and threatening you? And what was the public reaction to having your name posted in the newspaper as a doctor writing exemptions in California?
I wasn't following social media very much at that point, so I think there was probably more abreaction against me on social media than I was aware of.
Mm-hmm.
But there was a lot of concern for all of us doctors among the group of people who needed exemptions, the medical freedom crowd that
Mm-hmm.
was growing and learning to be vocal in these early years. So it still was a difficult place to be in because there was the reality of this person in front of me needs an exemption. What do I do? I may have to defend this in court. That was a moment by moment decision to make with every encounter. And I did, in the process of some of the legislative discussions, write 3 letters to the Sacramento Bee, letters to the editor, and they never published them nor acknowledged them. They were very harsh, the Sacramento Bee, on Bob Sears, describing him as very low in motivation and just greedy. So the targeting definitely happened, and probably more so on more famous doctors than on myself.
How many doctors at that time were writing exemptions in California that you know of?
I know of about 60, I would say, but that's not an exhaustive list or number. It's just those of us who had come together. The original organization that was serving this group was Physicians for Informed Consent, founded by Shira Miller, and that still exists and is active. And provides very good documentation on the research that shows what the actual risks are for the disease versus the vaccine for the disease. And you can get that educational material on their website, Physicians for Informed Consent.
And then of those 60, how many were pursued by the California Medical Board? Do you know?
I don't know for sure, but one physician who was the caretaker of Gavin Newsom's family, his children, was not investigated. I don't know how many or how visible she was in terms of writing exemptions, but she spoke at the hearings
And she
against
wrote
the law.
exemptions for Gavin Newsom?
I don't know. I haven't asked her, but that would be the kind of thing we want to know. Who
Mhm.
has exemptions and what's actually in the CARES database that is the collecting of all that information on who's exempted and who's not. So the tracking system began simultaneous with everything else. And every exempting physician that I know of that was investigated was disciplined. I
Mm.
don't know of any that were not disciplined, except that one.
So, how exactly were they tracking these exemptions? Were they asking parents to narc on their physician, or what? How did they get this information? Or were they going to schools and getting it?
Schools was the most efficient way. And the nurses appeared to have been trained to identify the wording of an exemption that was different than what the law says.
Mm.
So in the exchange of emails between the medical exemption pilot project and the school nurses, they would say, this doesn't seem to fit. So in effect, nurses place themselves over the doctors. Maybe you could say practice medicine without a license to judge this physician's signature is not my standard.
Mhm.
That's not unusual in the time period, as we know. When we evolved a little further, pharmacists were doing the same thing
Right.
over the physician's statement and saying, I won't give you the ivermectin, the hydroxychloroquine. What's the diagnosis? They usually don't ask that. So there was an upheaval of the doctor's authority starting in 2015 and going forward from there.
But they didn't come after you until the pandemic. Is that correct? Until 2021?
That's true. And any investigation of a doctor in California is supposed to be completed in very short order, like 6 months.
Mhm.
But I was not investigated until 2019 for exemptions that I wrote in 2015, 2016.
Hmm.
And then it was finally 2021. So we were into COVID by then for sure, when I had my administrative law hearing. The board had offered me a probation, and I would have to fulfill some pretty expensive and extensive requirements. But I was moving to Massachusetts to be grandma, so it didn't make sense to take probation. So I went into the administrative law hearing.
Mhm.
And that was very instructive because I had heard of the administrative state and the power of agencies, but I really saw it when I was there. I had a very experienced pediatric neurologist as one of my expert witnesses, and the judge was not impressed.
Right.
And every one of my witnesses were considered extreme and not convincing. So the record shows that I did not present a good case, and as a result, she said the only option is to revoke the license. And then that judicial opinion, the medical board adopted, and I lost my license. I challenged it.
Mhm.
There's a petition to reconsider Avenue. My attorney for the administrative law hearing said, I don't do those. So I did it myself with the help of an attorney friend. And the 300-page document I submitted was rejected between Friday afternoon and Monday morning. So they had not distributed it to the members of the board, nor had time to read it.
Mm.
And so I asked for an emergency injunction from the Superior Court. They gave it, and they said, you have to reconsider this. And I got an extra 10 days, I think. And eventually they still revoked my license. But it was quite an experience because I had not been exposed to legal events prior to this. And
Right.
there was never a patient complaint against me. There was never patient harm claimed. And I had 2,000 signatures on a letter to the medical board saying, please don't revoke this license. Please keep her active.
And I read that they came after you only for 8 exemptions. Does that sound accurate?
Well, there was 8 cases that eventually made it to the consideration of the medical board. I don't know how many exemptions I wrote, but it was a lot.
Mm-hmm.
But I know of a physician who only wrote 1 exemption and another who only wrote 2 exemptions, and those physicians were disciplined.
Wow.
And that was their absolute total that they wrote.
Wow. Wow. What made you different from other doctors in this regard? What was your wake up moment when you decided, I mean, what you're doing is the ethical thing to do, but most doctors don't do it. So what prompted you to go down this road?
Well, I think the clear thing for me was there's a need here and I can't say no.
Right.
And I know I'm on the line, but I know what the law says and I'm going to do it. And I wasn't alone because there was obviously other physicians. And this was close to the time of Yehuda Schonfeld's book by Wiley, the big publisher, Vaccines and Autoimmunity. So there was huge documentation and there was no true existing guidelines for how do you consider a vaccine medical exemption.
Mm-hmm.
And what we refer to as the ACIP guidelines are not about medical exemptions. Those are the listings of contraindications to giving a vaccine. And that's a different process
Mm-hmm.
because our law did not say contraindications. Later, California rewrote the law and put in contraindications. So the actual act of giving a medical exemption could be congruent with the ACIP guidelines. But a doctor had called ACIP and said, are these mandatory, the guidelines? And ACIP itself said, no, those are guidelines. The doctor makes the decision.
Mm-hmm.
So over and over again, we were reassured of what we thought was the way the system was set up. And yet, in actually enforcing the practice of medicine in the state of California, it was very much more stringent and was turned against us.
Why do you
And I
think
think I had always heard from patients.
Yeah.
My patients weren't crazy.
Right.
I had talked to them for like 40 years about their family history, their health history. I also grew up in the 50s, so I had measles, mumps, chickenpox, hepatitis A,
Right.
and lived to talk about it. And in the 70s, when I was in medical school, the MMR came out and they said, there will be 1 dose of this needed. That's all.
Mm.
And then as I went through my medical practice, pretty soon it was 2, and then it was more. And then finally, at a certain point, they said, well, there's no point in a 3rd one because it doesn't do anything. But the number had just increased. So I could see the reasoning process shift, and I knew that it wasn't like written in stone. And we even had continuing medical education courses where gastroenterologists would say there's no need for hepatitis B vaccine except for the rare mothers who are hepatitis B positive and maybe of Asian descent and prone to liver cancer.
Mm-hmm.
And it's a fairly benign disease.
Mm-hmm.
And that's a gastroenterologist saying
Mm-hmm.
that.
Mm-hmm.
Now we know where we are.
Right.
Babies get it in day 1.
So you've been practicing a while. Have you
Yeah.
seen a shift in disease in children since these vaccines have come out? Or the number has increased dramatically. Have you seen a corresponding change in your patients being either healthier because of all these vaccines or less healthy because of all these vaccines? Has your practice changed?
Yes, definitely. And as part of this, I experienced through practice itself and sometimes just as a woman becoming a mother.
Mm-hmm.
There was no ear infections when I was growing up, and kids didn't wear glasses. And now there's almost every classroom is a special needs classroom.
Mm-hmm.
You have to have EpiPens, you have to have special assistants to help with children who are hyperactive or unable to really respond to a normal environment. And the numbers of medications the numbers of, we've medicalized our population of children over time. So yes, that's very much borne out in my personal experience.
Do you think that the rise in autism is related to the rise in the number of vaccines kids are getting?
Yes,
Yeah.
yeah.
Why do you think the board waited until the pandemic to come after you?
Well, that's a good question. I don't know that I have a good answer. Um, there may have been some deliberation among the board and the legislators in California because there was about a 4-year lapse between the first law and the second law. And if we look at the criteria applied to the doctors exempting when the first law, SB 277, was in effect, it's really the criteria that became the law in 276. So they used that falsehood of ex post facto, or whatever the right legal term is, to apply a standard that was not in existence to the past.
Mm.
And so that's a misjudgment of us because there was a different standard in effect while we were exempting. And so I think there might have been an evolution of public opinion, and I don't know what was going on behind the scenes in terms, because there was a lot going on behind the scenes during the legislation of the first law. Committee members were changed, dates of committee meetings were changed in order to get approval.
Mm.
There was a remarkable statement by parents to the medical board members in which the medical board members voiced their disagreement with the law. And the medical board administration kind of panicked and said, well, we're going to shut this discussion down now. And then a few members changed on the medical board and they came out in agreement with the law.
Mm.
So there was a place where the legislators and the medical board members would listen to the public, could be impacted. But I see much more flexibility in the makeup of the Massachusetts legislators than I did in California. I think California was more hardcore, sold out, bought
Mm.
by pharma and determined to go down that road than I see in the state I live in now.
But Massachusetts took your license as well, correct?
They did, and I did not know the principle of reciprocal discipline existed. It applies to all professional boards, and if a attorney, doctor has been disciplined in one state, then a second state that has licensed that professional can say, was this proceeding fair in the first state? And if so, we may apply similar discipline to that person and revoke their license. So I represented myself pro se again in Massachusetts, fought very hard, but there was no consideration. It was just gone. And then in New York, I had 40 years ago applied for a New York license thinking I might go there and live in a big city because I'd never lived in a really big city. I never took that job, but that license was revoked, even though it was 40 years old and never used.
Wow.
So they chose to spend New York money because I was a danger.
Do you think that's the FSMB working? Do you think that, we, as people may not know this, but Dr. Sutton and I are also suing FSMB, which is a private entity that somehow has control over all the state medical boards. And so we're going after them. The main issue with our lawsuit is about free speech and a doctor's right for free speech. And writing an exemption is our free speech right. It's our right to have a medical opinion. And the government is certainly not allowed to govern free speech. But now we've got this private entity that somehow has a stranglehold on all state medical boards, dictating what doctors across the country can say. So I don't know if you have some comments on that, Dr. Sutton.
I do. And I think, yes, I can't say every single step of how they do it, but I think the mechanism is there and the intention is global control of medical. practice and probably also veterinary practice, because holistic veterinarians are getting in trouble as well.
Oh, interesting.
And I think it's global, not just control of America, because a colleague, Dr. Bruce Dooley, stated that a doctor from New Zealand who was disciplined found that his discipline was sent to the Federation of State Medical Boards in the United States.
Hmm.
So why would a New Zealand doctor be tracked by an American private entity that wants to control American medicine? Well, it has bigger interests than just American medicine.
Right. And there is an organization, IAMRA, is that right? It's
That's it.
a global organization that's sort of like the FSMB, but on a global scale.
Yes.
Um, oh, and that, one thing we should talk about, Xavier Becerra, who
Yes,
I think he's running for office in California, right?
he may be. I know Senator Pan is running
Mm-hmm.
against a sitting Kevin Kiley, I think, in California. And Senator Pan is a pediatrician by statement, although I don't know that he really carried a practice very much. He was primarily politically active. So he's running for office, and he had initially kind of disappeared after his second elected term completed. So now he's back and seeking office. And I hadn't heard about Javier Becerra, but that could be.
Yeah, and so he was head of HHS during the pandemic, uh,
Yes.
but he was also instrumental in California medical boards going after doctors for writing exemptions, from what I understand.
I think he was Attorney General
Right, right, right.
when we were going through that. So a whole lot of California well-known influencers became transplanted to the federal level uh, when our exercise with the SB 277 was finished. Kamala Harris became vice president. Javier Becerra went to HHS, and I think there was others as well that had influence, including maybe Charity Dean at the federal level.
Mm-hmm. Is it possible to get an exemption in California now?
Supposedly, yes. And the criteria are the very strict criteria. And this is under the newer law, SB 276. So it restricts a doctor to writing 4 medical exemptions per year. Now, that means I can't serve a patient who comes into my office with real need if they happen to be unlucky, number 5, because I would then refuse and the law would tell me I should, or I'm going to be investigated if I write a 5th medical exemption in California.
That's insane.
So effectively, there is no such thing as a medical exemption if we really think about it.
And and it
Because
has to be a contraindication according to ACA, is that right? It's not just like
that's
a
correct.
family history of problems. It has to be like a
No.
personal history of a problem. Is that right?
Well, it has to be a reaction to a prior vaccine and a very small list of immune issues that are problematic, or something temporary like having just received immune globulin and I can't receive a single vaccine.
Mm-hmm.
One of the theories that is interesting medically is that the medical boards and their representatives would say there's no such thing as a medical exemption from all vaccines. You can only be exempted from one vaccine at a time because they have nothing in common. They're each individually. So that means 16 vaccines, you have to have 16 different instances of allergic-like reactions in order to be exempt from the whole group. But the error in that thinking is that sometimes there's a makeup inside the person
Mm-hmm.
that is so prone to adverse reactions that makeup should not be challenged by anything that's inflammatory.
Mm-hmm.
And that's the commonality that vaccines have. They're all inflammatory
Mm-hmm.
by design. That's the only way they work.
Right. Right. Yeah, that's really I mean, I don't know how I mean, I guess if I were a parent in California, that would prompt me to leave the state. Do you know, are there other states that are as strict as California, or are they the strictest?
West Virginia and I think Mississippi were earlier than California in stopping the medical exemption, but not quite as big or visible.
Mhm.
And now I think their religious exemption is returning. California avoided the use of the term religious exemption and said personal belief exemption. And that's an interesting use of terms because the freedom of religion is in the Constitution of the state and the country. And so they sort of don't dare go to that. And in the legislative process of passing the first SB 277, the question of the religious exemption was brought up by some legislators and it was tabled. So they would not discuss directly the religious exemption. They just spoke nothing about it, said we're getting rid of the personal belief exemption. There will only be medical exemptions left. And by implication, there was no religious exemption anymore.
Wow.
But it was never really addressed.
And I would think somebody would sue over that. Are you aware of
Yes,
that? Yeah.
yes. And I'm not up to snuff on what all the lawsuits are, but there have been efforts. And I'm not sure how successful or how direct on just that topic.
Yeah. Well, thank you for standing up. I understand what, I'm getting parents asking me for broader exemptions for vaccines, but I really went through it during the pandemic, writing exemptions.
Mhm.
And thankfully, that's one area they did not come after me for. But
Mhm.
it was always, a concern writing them that, okay, is somebody going to turn me in? But it's the ethical thing to do. I mean, parents and
Mhm.
patients should have a choice ultimately. And it's not a one size fit all. We're injecting something into somebody's body and people don't all react the same. And
No.
you certainly have enough years of experience under your belt to be able to determine if there's a valid concern for a patient. So thank you so much for doing this and for fighting back. And hopefully we'll have a good outcome because it's pretty important.
Yes.
If we lose this, it sets a precedent that doctors really don't have a right to free speech, that we don't have a right to our medical opinion, that we can be disciplined for our medical opinion. So it's important that we succeed in this. So.
I agree. Thank you for your efforts.